So the Complex Psychological Interventions team, or CPI for short, is made up of a group of psychological therapists. So we have clinical psychologist, consultant psychiatrist and art psychotherapist who all work with in a team. So I'd say one of our real strengths is that we're a mixed group of, I suppose, highly skilled professionals. I think there's two things to maybe to understand about how CPI works. One is that we really seek to work with the teams around, I suppose, thinking about the psychological mindedness about the services that we offer. So in terms of helping maybe a care coordinator or a recovery navigator think about what kind of intervention might be appropriate, kind of psychological interventions, or giving the space for the team to think and reflect, either through formulation, like team formulation sessions, or supervision, or just kind of coming to us to talk through a case through a bit of consultation. So there's a lot of what we might call indirect work, I suppose, that's really what we hope is helping the team provide the best care for a client or a carer that might be accessing the service. But if somebody was using our service in terms of looking for an intervention, initially we would seek to meet with them, and that would be an assessment that might be 1, 2, or sometimes we even meet with people longer, because people have complex lives and stories that we're trying to make sense of together, and try and decide with that person what might be a good way forward in terms of their care. And I think being in secondary care really gives us the freedom to provide individually tailored approaches for them, but drawing on an evidence-based of therapy. So we have people that are trained in a range of therapies, from cognitive behaviour therapy, which I think is quite well understood maybe in the public, to something like dialectical behaviour therapy, which is it's a therapy for people who have been struggling really for a substantial part, maybe their whole lives, about managing emotions. And so dialectical behaviour therapy, or DBT, offers an individual and a group program, and that'd be for 18 months. That's quite a long time. So I suppose I could go on for so long, but I think there's something about us providing an individualised, tailored approach for that person that really draws on evidence-based and well-established therapeutic approaches. We're aware as a service that we work with people who've probably had really difficult things happen to them, and their difficulties have been around for a long time, often. And so there's something about offering a type of therapy that we believe is well suited and will provide them enough time to be able to hopefully make some of the changes, or process some of the difficulties, or manage some of the difficulties in their lives. And so that might take 6 months, it might take a year, or it might take longer, and then we would try and work with that and meet that need. But I think up to a year is what we really try and work with. Yeah. But we're also aware that I think some people come to CPI and think, okay, I'm going to have my therapy and then I'm going to be fixed. And with some people, their lives really do transform, and they do go on to really live much more of the kind of lives that they want to. But for other people, it helps with a particular difficulty, and that helps them move on to a certain area and live, I suppose, a less distressed life, or a kind of more worthwhile life. But that they might need therapy again in the future. So I suppose what I'm saying is that it might not fix everything, and therapy might not be the next step. It might be actually that they're getting a job, or building connections with friends or families, or starting going out of their, where they live. So it might be a different step other than therapy, but yes, you're right, it might be a step on that path to recovery.